Hello, my people. Yes, good day, everybody, from wherever you're watching us today. Today is a promised day, and thank God it came to be. Like I promised finish the other day, I will promise that I'm gonna bring you the video about constipation. And here is it. Constipation is a common condition that happens to so many people across the world. Whether you're human beings, there are some conditions that could cause you, bring you to having this experience. And what is constipation? Constipation is the condition that once somebody will be having the urge to defecate, but wouldn't be able to do that. Or you're having less frequent defecation or more, what you call bowel movement. So in at a lot of times you find yourself not being able to use the restroom because your body might feel like going, but when you want to try it, you wouldn't be able to. And most of these times, your feces, the stool, is hardened and it's difficult to do. So what exactly causes this? How does it happen? In your stomach, there are certain passages your food goes through that helps it in before it goes out of the body. So from your stomach, when you see through the intestines, the food moves through that, something like the pipe. We call it the intestines. The pipes, the small intestine to the large intestines. So as it moves through that pipe, it requires fluid to be able to be moving through easily and more smoothly. But when there is no sufficient fluid for its movement, it congeals and becomes very solid, and it becomes very difficult for it to pass. So in that situation, just imagine in your stomach, in your abdomen, the intestine, I call it stomach just like it is general, but we call it abdomen. So through the intestine, when it's moving, when there is this lack of sufficient fluid to help it move, the passage of these feces will be very difficult. And that begins to cause you what? Pains. To cause you what? Inability to defecate. To cause you some other conditions that will make you very uncomfortable. And somebody will stay like 1 day, 2 days, 3 days, and won't be able to use the restroom to defecate. So in this condition, it is not normal. This could cause you more problems. So to avoid it, what happens? In this kind of condition, what you do is to know what causes this condition. For someone who is having constipation, but basically, like I said, because of lack of fluid, how do you replace fluid? By drinking water. So there are natural ways to do this, natural ways to replenish or to help yourself relieve yourself from constipation before it causes you a bigger problem, before it becomes complicated. So to avoid this, you need to be taking water more often. Take water after eating. Take water when you ensure that you replenish your body of fluid, so that when you eat, there will be enough fluid to pass through the things you eat when it becomes feces. So when you are not drinking enough water, this could cause you constipation. For someone who stays at a place all the time and doesn't exercise, such condition could make your bowel not to have movement. The motility will be decreased, and you will not be having easy passage of food that have been digested. So these are certain conditions. Another thing is, as you age, the level of your physical activity decreases. So old age could equally be that. But some people, like the Chinese, for instance, example, because you see a Chinese person still playing tennis ball, still playing at an old age. So a certain culture helps them to understand that there is no time to decrease physical movement. They would rather be walking 10 miles a day just to ensure that they keep themselves fit. So this is a kind of culture that you can equally imbibe in your own culture, wherever you're watching before. Other things that could cause you constipation are medications. What kind of medication do you take? Or when you're having this, you notice that you're having constipation more often, and you begin to take laxatives. Too much laxatives could cause you more constipation and equally cause you complications of this constipation, which will come to that later. So these events in your body could cause you constipation. What other thing? Someone if you have experienced it, if you go to a new environment, it might be difficult for you, or you might not be very acquainted with the environment to use restroom, or to certain change of environment could cause you constipation. Another thing again to point out is when somebody is stressed, fear and anxiety too. So these are some, there may be other factors, but these are generally factors that might be associated with you won't be very familiar with, that could cause you constipation. So knowing all this, and medications, as I mentioned, certain medications like strong pain medications, when you take them, they are certain kind of, they could equally cause you constipation, and you have to see your doctor when this begins to happen, so that you know what you have to do in that situation. But when you have constipation naturally, or any kind of constipation, maybe you're pregnant, because pregnant women, if you notice, when someone is pregnant, they usually have that kind of condition. Why? Because it affects the organs in their body, even the intestines. So anything hinging on it will equally have to make it, impeding on it will equally cause the person not to be passing stool as normal as it should be. So taking laxatives should be only when it is recommended by the doctor. So what do you do if this is happening and you're not taking laxatives? You need to begin with fluid intake. Take water, drink water. The more you drink water, as it should be enough, good for your body, the better you will be able to pass your phases. Another thing you need to do is walk around. If you notice, pregnant women are often asked to walk. People who equally have surgery, some of them equally, most times they have constipation. That's why you come out from the surgical room, then walk around. Walking helps you, and that's, if it is surgery, the doctor will tell you that. But those factors that could affect you at home, you need to do this. Fluid, walking around, do other physical exercise that will help your abdominal or stomach motility, intestinal motility, to help you to be able to pass this. When these are tried, another thing you have to do again, I remember, taking food that would help contain fiber, fruits and vegetables, basically. Fruits and vegetables will help you, because certain foods like meat, basically, that contain and fatty foods will help make your body to be more, your food to be more solidified in the intestine, and you won't be able to pass through it, especially when you don't take enough water. So fruits and vegetables to increase your fiber, fluid, and walking around. These would help you to take care of constipation when you have it affecting your body. So given these areas I have pointed out, and if this doesn't improve, what you need to do is to see your doctor, because if constipation continues without being attended to, what will happen to you is that it could cause you what we call hemorrhoid or bleeding. And any bleeding that is coming from the stomach area, or when you're passing, is often very dangerous, because we don't know where it is coming from. If it is hemorrhoid, that has been identified and diagnosed. But if it is in the intestine, that could be something else and will cause you anemia and some other Crohn's disease, a lot of other diseases. Nobody would know what it is until you're very well diagnosed and lab done on you. So with these few given, we have to learn basically that constipation can be avoided. And if it eventually happens at all, these are the things you need to do. So I believe that this would help everyone watching this to take care of yourself, for your body is very, very much in need of physical activity, water, fiber to help you prevent and manage constipation. Thank you very much for your attention, and have a good day.